Okay, let's unpack this. Imagine a world where your healthcare, not just faster, more accurate, but like precisely tailored to you. Sounds like science fiction, right?
A little bit, yeah.
Well, our latest deep dive into artificial intelligence in healthcare suggests this future, it's actually closer than you might think. Today, we're really exploring how AI is genuinely reshaping the medical world.
Right. From diagnostics all the way to how hospitals even run day to day.
Exactly.
What's truly fascinating here, I think, is how AI is being leveraged, to supercharge diagnostics, craft personalized treatments, and fundamentally reimagine care management.
So that's the mission for this deep dive.
Yeah, pretty much. To pull out the core insights into its profound impact, but also, crucially, shed light on the very real hurdles and ethical complexities we need to grapple with as this tech integrates.
Okay. So where do we start with the tangible benefits? The sources really highlight its power in early diagnosis and detection. Think about this. AI systems analyzing medical images like X-rays, MRIs, and doing it with an accuracy that often surpasses human experts. How is that even possible?
Well, it's largely about scale and pattern recognition, and AI can look through, millions of images, far more than any single person could.
Right.
And it learns these incredibly subtle indicators, things a human eye might miss, or patterns that only become clear after seeing vast amounts of data.
Okay, give us an example.
Sure, take breast cancer screening. The potential impact there is immense. If AI could widely improve early detection, even just an 11% reduction in false negatives, well, that could mean around 209,000 additional cancer patients diagnosed earlier in the U.S. each year.
Wow, 209,000. That's huge.
It is, and significantly increases their chances of survival. So you have to ask, what does that level of early insight really mean for patient outcomes? It's potentially transformative.
That's a huge aha moment for sure. And then beyond diagnosis, it gets really interesting when we look at personalized treatments. The material points out how AI analyzes genomic data, medical history.
Right, your unique biological blueprint, basically.
Exactly. To recommend specific therapies. How does that work, say, in cancer treatment?
Well, it lets us move beyond that sort of one-size-fits-all medicine we've relied on. AI can identify very specific mutations within a patient's tumor.
Yeah.
And based on that, clinicians can recommend targeted therapies, drugs designed to attack only those mutated cells. It's much more precise.
And probably fewer side effects.
Potentially, yes. More effective, less toxic. It's a really granular, individual approach to medicine that just wasn't feasible before at this scale.
So not just better diagnosis, but smarter treatments tailored to the person.
It's, revolutionary. But it's not just about the direct patient interaction, is it? AI is also streamlining operations.
Absolutely. Behind the scenes, too. Consider the University of California, San Francisco Medical Center. We found they used an AI system that predicted emergency admissions.
Predicted them?
With 85% accuracy, which allowed them to proactively manage resources. Beds, staffing, before a surge hit, makes everything run smoother.
Yeah.
That makes sense. Better flow.
Or look at the Da Vinci surgical robot. It's assisted in over 7 million procedures worldwide now.
Assisted, not autonomous.
Correct. It enhances the surgeon's precision and dexterity, and the data shows it's reduced post-operative complications by about 30%. That improved accuracy makes a real difference.
Incredible efficiency and better outcomes. But
yeah.
Okay, with technology this powerful, especially in healthcare, we have to talk about the flip side, the challenges. Our sources definitely don't shy away from those. The big one for me is accountability. If an AI makes a mistake, maybe suggests the wrong thing, who's responsible?
That's a critical question, and the consensus in the material really stresses that AI should assist clinicians, not replace them.
Okay, so the human is still in charge.
Exactly.
Yeah.
The healthcare professional retains that final decision-making power. Human oversight is key. But then there's bias and equity, too.
Right. The data it's trained on.
Precisely. If an AI model is trained mainly on data from one demographic group, it might not work as well for others. It could lead to less accurate diagnoses or treatments for diverse populations.
So we need diverse data.
Diverse data sets, yes. And regular auditing of these AI models, it's critical for ensuring fair and equitable care for everyone.
It sounds like transparency is vital, too. Understanding how the AI reached its recommendation, not just getting an answer from a black box.
Yes, that's what we call explainability. The goal is for the AI to show its reasoning, much like a human doctor would explain their thinking. That's essential for building trust.
So ultimately, this deep dive points towards a future where AI could make healthcare, well, more efficient, Definitely more precise and maybe more accessible.
That's the promise, yes. If we connect this to the bigger picture, it's really about building that trust carefully, ensuring that human well-being is always, always the top priority.
Absolutely. It paints a picture of AI as a powerful partner in health. But it also leaves us with a pretty compelling thought, doesn't it? As AI integrates further into our medical lives, how do we really ensure it serves all of us? Fostering equity and maintaining that essential human touch and care.